You finally got your GLP-1 medication prescription, you're excited to start your weight loss journey, and then the nausea hits, or the sulfur burps, or the soul-crushing fatigue. GLP-1 GIP medications are the most powerful tool we have ever had for weight loss and metabolic health. But let's be real, they can make you feel miserable if you don't know how to manage the side effects. Hi, I'm Dr. Bazgha Khalid, and I'm an internal medicine and obesity medicine specialist, and I prescribe GLP-1 medications in my practice every single day. And today I'm giving you the ultimate GLP-1 side effect survival guide. In this video, I'll cover how these medications actually work in your body, the big 3 side effects and the hacks to manage them, serious red flags you can't ignore, including that black box warning on these medications, and the exact questions you need to ask your doctor at your next follow-up. Stick around until the end because I am debunking the biggest myths that might be holding back your progress. Let's dive in. So how do GLP-1 GIP medications work? First, let's understand the reason for common side effects, or why do you feel sick on these medications. These medications, like semaglutide and tirzepatide, mimic hormones your body already makes. The GLP part tells your brain you're already full and slows down your stomach. Think of your stomach like a slow-moving conveyor belt. On these medications, this belt slows down significantly. That is great for weight loss because you stay full longer, but if you put too much cargo on that slow belt, it backs up. That backup is what causes the nausea and the bloating. Let's talk about common side effects and management hacks. Most people on GLP-1 medications experience nausea, sulfur burps, and fatigue. Here is how we beat these side effects. For nausea, the most common side effect on GLP-1 GIP medications, the hack to manage nausea would be to eat smaller meals, mostly bland food, think crackers, protein shakes, or cold fruit. The pro tip is don't drink water with your meals. Sip it 30 minutes before or after. It prevents your stomach from getting too full too fast. Then is the infamous sulfur burps. The cause for this is the food sitting in your stomach for too long starts to ferment. The fix for sulfur burps is to avoid heavy fatty foods, especially at night. Try Pepto-Bismol or digestive enzymes and slow down your chewing. Eat smaller meals and eat slowly. Another common side effect is fatigue. The fix is electrolytes. Often you aren't just tired, you're just dehydrated because your thirst signals have been dampened. Aim for around 80 ounces of water a day with a pinch of sea salt or an electrolyte powder. Now let's learn about some serious side effects and the black box warning on GLP-1 GIP medications. These medications are generally safe, but there is FDA black box warning as well as some serious side effects that you should be aware of. The FDA black box warning on GLP-1 GI medications that you will see warning about thyroid C-cell tumors. In rat studies, there was an increase in these tumors, while we haven't seen this clearly in human studies. If you have a personal or family history of medullary thyroid cancer or MEN2, these medications are a no-go. Some serious side effects are pancreatitis. This is less common but a very serious side effect. If you feel severe stabbing pain in your upper stomach that radiates to your back, stop the medications and call your doctor. Another serious side effect is gallstones. Rapid weight loss can cause gallbladder issues and gallstones. If you have sharp pain under your right ribs, nausea, vomiting, don't ignore these symptoms and get it checked right away. So what do clinical studies show about the side effects? The clinical trials like STEP and SURMOUNT trials show that about 10 to 15% of people stop these medications because of side effects. My goal is to make sure you aren't one of them by educating you about these side effects as well as how to manage them. Here are some tips to manage side effects. Eat slowly and eat smaller meals. Hydration is key. Fiber keeps your gut healthy. Prioritize protein, 35 grams per meal. It protects your muscle. Strength train 2 to 3 times a week. Track trends, not daily scale numbers. And avoid these. Don't force yourself to eat if you're stuffed. Avoid fried fatty foods. Avoid ultra-processed foods. Don't quit medications cold turkey without a plan. Don't compare your loss per week to someone on TikTok. Let's debunk some myths. Myth is you're cheating. Fact is obesity is a chronic biological disease. You wouldn't tell a person with asthma that their inhaler is cheating. Another myth is you have to stay on the maximum dose to lose weight on these medications, while the fact is many patients do incredibly well on low maintenance doses of these medications. Here are some questions for your doctor. Next time you see your doctor, ask these three things. Is my current dose the minimum effective dose? What is my plan if the side effects don't improve in a couple of weeks? How are we monitoring my muscle mass, not just my fat loss? I want to hear from you. What side effects have you experienced on GLP-1 medications and how did you manage them? Leave a comment below. I try to comment on as many as I can. If this video helped you, hit that like and subscribe button and share it with a family member or a friend wanting to know more about GLP-1 medications. Remember to keep focusing on health, not just the number on the scale. Stay happy, healthy, and stay informed. See you in the next one. Bye for now.